Good afternoon, everybody. It's March 25th, 2020, about noon. I wanted to bring everyone up to date on where we're at and what's going on with some issues regarding, of course, to COVID-19. The status of as of noon is I got the latest numbers and everything for you. You can probably find these online also. The total confirmed COVID-19 patients in Polk County is 13 as of right now. Of those 13 patients, Polk County Fire Rescue actually transported only one of those. So we've only had confirmed contact with one patient. The current COVID-19 toolkit is dated March 24th. That's the latest information, protocols, practices, those things that you need to be familiar with. Make sure the version you got is dated yesterday, March 24th. That's the most current one. There's been some questions too. Well, where does that information come from? The Office of Medical Direction, OMD, wanted me to make sure that you guys understood where we're getting that information from. These come from the Centers for Disease Control, the CDC, and they're specific guidelines for EMS providers. That's where they come from. But they do change a little bit. Also, Dr. Banerjee confers with some of the local experts. Dr. Banerjee is a medical director. He confers with Dr. Jackson. She is the health department, Florida Department of Health leader of that, and she has an epidemiologist that answers to her also. So she gets that information. So between our local experts, Dr. Banerjee, Dr. Jackson, and the epidemiologist, any other questions that we have that are not covered in the CDC guidelines, those folks talk over and give us the best advice. Things are not made by in local in the OMD office. They're consulting with the experts in the field for this. Also, one of the things that's come out is there's a little bit of frustration because there's been some changes, frequent changes in that viral screening tool that you guys are using in the field. Wanted to let you know that Dr. Banerjee, this virus, if you recall, had never been around before, so the screening tool was changing frequently. Dr. Banerjee feels now strongly that unless there's a significant change in the behavior of the virus going forward, that the screening tool is pretty much leveled out. I know it must be frustrating. You leave work one day and it's one thing. When you come back to work, it's changed on the next shift. Expect that to level out right now unless there's been significant changes in that behavior. I want to also update everybody on the employees' status, what the status of some of our employees. Right now, our health and safety officer is monitoring about 30 employees. We have 2 that are on a 14-day home isolation. They're expected to clear on March the 30th, so they'll be getting back into service on the 30th. We have 26 right now on a 1 to 7 day home isolation, and they're waiting on test results. Now the test results, as you can imagine, since this thing is spun up, when we originally started testing folks and the patients that they transport primarily, that we were getting a turnaround of, say, 48 hours. As the testing has ramped up in the community, those tests, the testing centers get backed up. So now it's anywhere from a 1 to a 7 day. Now that's supposed to, as you can imagine, as things get geared up, things may get a little bit better in that area. One of the things that may happen as early as Friday is some of the testing may become local from some of the healthcare providers, and they may be able to do it as fast as 45 minutes in some of the healthcare places. So that should greatly improve as time goes by. Want to be very clear. No employees of Polk County Fire Rescue have tested positive yet for COVID-19. Want to make sure everybody understood that. The other thing I want to make sure is that there may be some questions your family has or you have or something that's not covered in the material that's available to you or you found out. Please contact our health and safety officer, which is Captain Mark Bradshaw. His number is 863, of course, 344-2036. Again, Mark is waiting, wants to help our folks out, make sure that you guys get the best information or guidance you can at the time. Wanted to do, as you read the protocols and the toolkit, I want to make sure that you understand one thing. The very most important factor is wearing the appropriate PPE in accordance with the latest protocols in that toolkit. That's the single best thing that we can all do, is if on those situations where you're confronted, have your PPE on, have it properly on, and the right stuff in that. So again, just want to bring you up to date a little bit, nothing very long. but that kind of gives you a snapshot of where we're at right now. We don't have PPE to waste, of course, nobody does, but we still have supplies of the masks, the gowns, and Tyvek, and we have a contingency plan with more on order stuff coming in. So, but for right now, please wear it properly and in accordance with the rules that we have, the protocols. So, any questions, as usual, contact me, Rick Parnell at polk-county.net. I'll post that too, as well as you saw the number underneath when I was talking about Mark Bradshaw. Again, everybody stay safe, and we're here for you. Talk to you later.